Wel, prynawn da, thank you for joining me once again. Here in Wales, the rapidly changing circumstances caused by the new Omicron variant means we are reviewing the public health situation every week. Even since I spoke to you on Friday, the number of confirmed Omicron cases has risen sharply, and at the same time, we are also seeing a rapid rise in the overall rates of the virus across Wales. We expect this trend to continue and to accelerate. Omicron is here already in Wales, and it is now spreading quickly. In England and Scotland, it has already overtaken the Delta variant and become the dominant form of coronavirus, and that will soon become the case here in Wales. Omicron has a doubling time of around 2 days, and on that basis, by Boxing Day, we can expect to see many thousands of new cases across Wales every day. Already we know that people are off work sick, putting essential services under strain, and after Christmas, we have to be prepared for that situation to worsen. It is an incredibly fast-moving situation. Just a few weeks ago, no one had heard about the Omicron variant. Today, most countries right across the world are affected by it. And that's the reason why the Cabinet here in Wales has been meeting almost every day, looking at the very latest scientific advice and the latest data, and we've been considering what protections we need after Christmas. And that's what I'll be focusing on this afternoon. By the end of last week, we had already decided that we would be introducing new measures for retail and for workplaces when they reopen after Christmas. On Tuesday, we decided that sporting fixtures will have to move behind closed doors for the time being. And today, I can set out further measures we are taking to protect people's health and to help businesses continue to trade after Christmas is over. We are introducing a new Alert Level 2 for hospitality businesses, cinemas, theatres and public gatherings, measures that have now been tailored to the new Omicron variant. At Alert Level 2 measures, all Alert Level 2 measures, including retail and workplaces and the closure of nightclubs, will come into force from 6 a.m. on Boxing Day. The new measures will mean a general requirement of a 2-metre social distancing in all premises open to the public and in workplaces, subject to that test of reasonable measures. The rule of 6 will apply to gatherings in regulated premises, such as hospitality, cinemas and theatres. All licensed premises will need to take additional measures to protect customers and staff, including table service and collecting contact details. Face coverings will be required in hospitality settings at all times apart from when seated. Large events will not be able to go ahead indoors or outdoors. The maximum number of people who can gather at an indoor event will be set at 30, and 50 people will be able to meet outdoors. There will be an exception for team sports, where up to 50 spectators will be able to gather in addition to those taking part, and there will be an exception, as previously, for events involving children. For important life events, such as weddings, civil partnerships, funerals and wakes, the number who can attend will be determined by the ability of the venue to manage social distancing and other reasonable measures. And all guests attending a wedding breakfast or a funeral wake will need to take a lateral flow test before attending. Now, the Cabinet has thought hard about how we deal with people mixing in each other's homes and in private gardens. and we have decided not to make new legal rules to cover that sort of mixing. We will issue updated and strengthened guidance to help people keep safe. We're doing this because we are in a different position this year to the position we faced the last time we saw coronavirus rise in this way. We have a population that is largely vaccinated, the booster is being rolled out rapidly, and lateral flow tests are easily available. And nearly 2 years since the pandemic began, we have all learned a great deal about how we can best protect ourselves and others. Now is the time to redouble those efforts, drawing on everything that we have learned. Omicron thrives on human contact. Every contact we have is an opportunity for us to spread or catch the virus, and the home, where we are surrounded by family, is where we are at our most vulnerable to infection. To stay safe in our own homes, we are advising that everybody follows 5 simple measures. First of all, limit the number of people visiting your home. Secondly, if you are visiting or if people are visiting you, take a lateral flow test before that takes place. Remember that meeting outdoors is safer than indoors, and if you have to meet indoors, do everything you can to make sure that it is well ventilated. If you are seeing family and friends, then space out those visits. Don't see everybody all at once and at the same time. And finally, don't forget all those basic things that we've learnt to do together. Social distancing, respect for others, washing our hands, and so on. All of that will be guidance, strong guidance that people in Wales can draw on. But we will reinstate a specific offence in regulations for large gatherings in private homes. This is because Omicron thrives in large gatherings and in enclosed spaces. Now, of course, we want these measures to be in place for the shortest possible time, and that is why they will continue to be kept very regularly under review. Moving to Alert Level 2 is designed to help businesses continue to trade while also strengthening measures to protect people's health. But we recognise, of course, that these are measures which will have an impact on businesses. As a result, £120 million will now be made available by the Welsh Government for nightclubs, events, retail, hospitality, leisure and tourism businesses affected by the move to Alert Level 2, and that is double the new funding of £60 million that we announced only last week. And the Economy Minister, my colleague Von Gethin, will announce further details about how this support will operate tomorrow. At the same time, we have already announced in the last few days further funds, additional funds to support sports venues and arts and cultural organisations affected by the pandemic. Now, the wider context in which we are making these decisions continues to change very rapidly, and I can announce one further change to the rules that we have decided to introduce today. Fully vaccinated adults and children aged between 5 and 17 who are identified as contacts of someone who has tested positive for coronavirus will now be asked to take a daily lateral flow test for 7 days instead of needing to self-isolate. And this is known as the daily contact testing regime. People who have daily negative lateral flow tests will be able to continue to go to work as normal while following all those other steps that help to keep themselves safe, including limiting the number of people they mix with as much as possible. If you've not been doubly vaccinated and are identified as a close contact of someone who has COVID, then you must self-isolate. children under the age of 5 are exempt from self-isolation if they are close contacts. And as well as that specific decision, then during the day, the Health Minister will consider advice from the Chief Medical Officer about potential changes to self-isolation arrangements from people who fall ill from coronavirus. And we are also expecting today to receive further recommendations from the JCVI about the vaccination of young children. Now, nobody wanted to see the return to alert levels and to the protections that I've announced today. But we are now entering a really serious phase of the pandemic. Wales will reopen after Christmas. But in order to do so safely, we have to do everything we can to go on protecting ourselves and taking care of others. The way in which we have got through all of this in Wales has been by working together, and that's what we need to draw on again in the weeks ahead. And beyond that, we know that there will be brighter days ahead. Diolch o galon I chi gyd a Nadolig llawen I phawb. I'll now, as ever, take questions, and as usual, all the answers will be broadcast live on the Welsh Government social media channels. And first up today, over to Owain Phillips at BBC Wales.
Pnawn da I chi, Prif Weinidog. Significant restrictions being announced today, but you don't have furlough support from the UK government. If you had furlough support, would you have gone even further if you could have today?
I think the measures that we have announced today are the ones that we think are sufficient in the light of the information we currently have. But Owen, you're absolutely right that in order to go further, were that to become necessary, the Welsh Government simply does not have the financial firepower or even the practical ways of getting help to people who might not be able to be in work. For that, we need the help of the UK Government. And I join my colleagues in Scotland and Northern Ireland in calling on the Treasury to put those furlough arrangements in place for the sectors that are most directly affected by the extra protections that will need to be there when they reopen after Christmas.
And can I ask, in terms of a time frame here, I know it's difficult and I appreciate things are moving quickly, but could you give us an idea of how long you envisage some of these restrictions being in place, especially in terms of there may be people out there trying to plan weddings and so on? Can you give us a rough idea even how long would you expect this to be in place?
Surely, well, as you know, we review the regulations in law once every 3 weeks, and more recently we've been reviewing them on a weekly basis and introducing changes where we need to do so. So people in the wedding sector and others can have that confidence of knowing that we will be reviewing the regulations absolutely regularly as we move into January. Now, the modelling that we see tells us that we have to expect a sharp rise of cases into January, and then compared to earlier variants, a relatively sharp decline in those numbers as well. The extra money that we have announced today, the doubling of the new money to 120 million, means that we are able to extend the help that my colleague Vaughan Gethin will announce tomorrow into February as well, should that help be needed. Owain, diolch yn fawr. Over to Jane Death at Channel 4.
Thank you. Good afternoon. You said yourself in your statement that we're in a different position this year than last year. Many more people have been vaccinated, and it seems the Health Security Agency have found Omicron is less severe than other forms of COVID. So don't the restrictions you're imposing on Wales now look like an overreaction?
It really is a misunderstanding of the position we are facing. to think that if Omicron is less severe than Delta, that solves the problem. If Omicron was only half as severe as Delta, because of the extra speed at which it is transmitted, that would buy you 48 hours before you see those numbers and numbers of people going to hospital climb to the very steep levels that we have seen. So the information on whether it is more serious is much more contested, I think, than the headlines of the Health Protection Agency's report that I have seen. The detail that I have seen suggests that if you have already been infected by coronavirus, it may be that Omicron will not be as severe as the first time you were infected. If you're getting it for the first time, there's no evidence that it is any less severe than any of the earlier variants. So I'm afraid, nice as it would be to think that will solve the problem of January for us, just the sheer number of people who will fall ill and the more nuanced information about severity means that the protections that we have announced today are a necessary precaution against the impact that we think we will see in Wales.
You're introducing fines for people who don't work from home. Aren't you punishing the wrong people who perhaps can least afford £60 fines over the Christmas period, which is expensive enough?
Well, thank you for that question, because I really want to lay this story to rest today, because it is a story without substance. The rules that we are introducing are exactly the rules that we had earlier in the pandemic. They are not some new set of rules. They are designed to protect workers, not to penalise them. When these same rules were there earlier in the pandemic, no fines were issued at all when these rules were previously in place. They are there to make sure that if a worker feels that an employer is unreasonably expecting them to be in the workplace when they could work from home, that they are able to point to the regulations and make it clear that they would be committing an offence were they to do so. So it is to protect workers, not to penalise them. When these rules were in place earlier in the pandemic, they worked very well. They will work very well again, and I'm very grateful to the employer organisations, the CBI, and to the Wales TUC for their help in making sure that the correct message about what the regulations mean is being communicated in workplaces and to employees as well. And thank you, Jane, for the chance to put that properly on the record today. Over to Daniel Davis at BBC Wales.
Diolch, Prif Weinidog. When will you publish the scientific evidence that's brought you back to announce restrictions again so quickly? Yes, the number of Omicron or COVID cases has risen, but surely we were expecting that. You've told us to expect a tsunami of cases. So what else have you seen, and when can we see it in terms of evidence? I'd be grateful if you could answer that in Welsh as well, please.
Well, we publish absolutely routinely the advice that we get through our technical advisory group. We rely on the advice of SAGE as well, and the SAGE advice was last published on Saturday, I believe, last weekend. We put into the public domain everything that we see when we review the regulations. The Chief Medical Officer always includes a report alongside it, and we always publish that report as well. Let me be clear about what we are seeing. We are seeing evidence of a new variant already here in Wales, where the number of new cases is accelerating every day, where the doubling time means that those cases will be in thousands within a short number of days, and where the impact on people falling ill and becoming so ill that some of them will need to be in hospital is very significant indeed. I think that the actions we have taken are absolutely proportionate to the risks that we know are there and which we will be facing here in Wales. So ni'n gyhoeddi bob tro y cyngor sy'n dod ato ni. y cyngor mae'r Prif Swyddog Meddygol yn rhoi ato ni. Ni'n cyhoeddi hwnna, ni'n cyhoeddi y cyngor sy'n dod o'r grŵp o bobl sy'n arbenigwyr yn y maes. Ni'n cyhoeddi fel ar lefel y Deyrnas Unedig, y cyngor sy'n dod oddi wrth y pwyllgor sage ac yn y blaen. A ni wedi wneud hynny trwy'r y pandemig i gyd, yn ni'n mynd i dal yn y dyfodol i wneud hefyd. A beth mae'r tystiolaeth na yn dangos iddyn ni yw, mae Omicron yng Nghymru yn barod, mae'r nifer o bobl sy'n cwmpo'n dost yn cynyddu bob dydd, erbyn yr wythnos nesaf, bydd miloedd o bobl yn cwmpo'n dost gyda'r amrywiolyn Omicron. Mae hwnna'n mynd i cael effaith ar y nifer o bobl sy'n gallu bod yn y gweithlu, ac mae hwnna'n mynd i cael effaith ar y gwasanaeth iechyd hefyd. Dyna pam ni wedi wneud y penderfyniadau dwi wedi cyhoeddi hefyd i warchod bywydau, i warchod y gwasanaeth iechyd ac i helpu ni i gyd pan mae'r ton o'r amrywiolyn newydd yn dod ato ni yn mis Ionawr.
Diolch. And you've asked people to limit their social contact today, but you haven't gone further and said limit to what? Because under your regulations today, you'll be able to see a lot more of your friends at home, in each other's homes, than you can in a pub.
Well, they won't be in regulations. As I tried to explain, we will be relying on guidance for the way that people behave in their own private lives. And as I tried to explain, there are reasons why we think that we can do that because of the vaccination and the booster programme, because of the availability of additional protections like the lateral flow tests, and because we have all learnt so much over the months about the ways in which we can act in our own lives to keep one another safe. The guidance will point to the fact, if people want a rule of thumb, that when we were last in more formal restrictions, we suggested that 3 households was the sort of maximum number who should get together at any one time. But that is a rule of thumb for people to apply should they need to do so, rather than because it will be part of the regulation framework here in Wales. Daniel, diolch yn fawr. Over to Inzamam Rashid at Sky News.
First Minister, is there anything you've seen in the evidence about the severity of the disease and mortality from the UK HSA and the specifics in that data? What have you seen that has led you to make these quite strict measures, certainly compared to England?
Well, 2 things we see in the data. One is that the doubling time and the speed at which Omicron is transmitting itself to people means that even if it is less severe, the sheer numbers of people who will fall ill will drive people out of being able to be in work and in some cases, sadly, into hospitals. And we're seeing in London and in Manchester, significant rises already in the number of people who fall so ill from Omicron that hospitalisation is necessary for them. So it's that combination of factors. Just the sheer number of people who are likely to fall ill will mean that the impact on the health service will be very significant indeed at a time when the health service is trying to do all the other things we ask it to do, and we've got to act now, we believe, to mitigate that impact. As I say, the evidence that I have seen previously is a bit more equivocal in relation to seriousness. I don't think it is as simple as saying Omicron is less serious than Delta. If you've been infected previously, it may be that it is a less severe attack. If you've never had coronavirus and you get Omicron, the evidence is probably that it's just as severe as any other form would be.
And so with that, how pressured is your health service right now? Can you tell us how many absences there are in hospitals within staff?
Sure, thank you. So the health service in Wales, as in the rest of the United Kingdom, is under very significant stresses and strains. although the number of people in Wales in a hospital bed because of coronavirus has been coming down in recent weeks, we're still talking about hundreds of people occupying a hospital bed who wouldn't be there if if coronavirus itself wasn't there. And at the same time, the health service is trying to do all the other things we ask of it, dealing with emergencies, trying to catch up on treatments that weren't possible earlier in the pandemic, and at the moment, this enormous effort to offer a booster vaccine to every eligible adult in Wales before the end of this calendar year. More than 50,000 people received a booster in Wales yesterday, and that's because health service staff are doing all of that on top of everything else we ask them to do. So when you look at it in the round, even a relatively modest additional impact from the Omicron variant will be meeting a system that is already at full stretch and where we are already beginning to see the impact of those elevated numbers in the workplace. So sickness levels in the Welsh NHS are up this week, not hugely, but every single % of people who aren't able to be in work is fewer people to deal with an additional demand. So it's been running just over 7% of people unable to be in work, and that number's gone up again this week. Thank you very much. Over to Bronwen Weatherby at PA.
Prif Weinidog. You said there's likely to be a huge spike of Omicron in January. Does that mean you are more likely to increase restrictions in the coming weeks rather than reduce them?
Well, I think, Bronwen, it depends on how successful the measures we've already announced will be, because if those measures succeed in flattening the curve as we see it, then we will not introduce any more protections than are necessary to save people's lives and to protect the NHS. That's why we've moved earlier than other parts of the United Kingdom. That's why these protections will kick in straight after Christmas. And if they have the intended effect, it mitigates the risk that we will need to do more. If we need to do more, the Welsh Government will not stand back. We never have. These are difficult decisions. They're not always popular decisions. But if the evidence says to us that more has to be done to prevent unnecessary deaths and avoidable harm, then that is what we will do.
And you've introduced £120 million worth of funding for hospitality venues, nightclubs and so on. Has the UK Treasury footed any of this money? It would be good to get an idea of where that money has come from, and if there's a cap on how much venues can claim, like the UK government's £6,000 grants for businesses.
On the second part of the question, Vaughan will set out the detail of our scheme tomorrow. We are trying to design the scheme to be as close to previous forms of help that we've offered businesses in Wales, so that the administration of it can be as easy as possible for them and for our local authorities that we rely on to help us with this. In terms of the money, the UK government says that they have given us an extra £270 million. I want to be clear that it is just not as simple as that. That money depends upon the amount of money that is spent on similar services in England. We may get a bit more than that, but we may get less than that. So in that sense, we are proceeding at risk here. But our assessment of things is that because of the protections we've announced today and the impact they will have on businesses, the Welsh Government will step in. We will use some money of our own that we're able to mobilise, and we'll take the risk that the money that the UK Government has announced turns out to be real rather than fictional, in order to give businesses in Wales the confidence they need that if they're not able to trade as they would normally, and that has an impact on their income, the Welsh Government will step in to assist. Bronwen, thank you very much. You can vowed. Over to Dan Bevan at LBC.
Thank you, First Minister. Good afternoon to you. People in Wales are now facing another Christmas period with harsher restrictions than over the border in England, despite having lower case rates. Now, obviously, your approach compared to Boris Johnson's is very different. And simply put, you can't both have the correct approach here because of it being so different. So do you think that people in Wales have a right to feel hard done by with these added measures?
I think people in Wales will feel that everything is being done on their behalf to keep them safe at a very challenging time. I think they will recognise that they have a government that is capable of making these decisions, even when the decisions are difficult and, as I say, when they are sometimes not popular. Here in Wales, we are in a position where when we see the evidence, and we're told about the actions we can take to protect people, we will take them. I think there's a real contrast with the paralysis of the UK government, simply unable to act. I heard the Prime Minister earlier this week in an interview say that the position had never been more urgent, and asked what he was going to do about it, said that he was doing nothing. Well, that would not be acceptable to me, leading the Welsh Government, when we see a situation that is urgent, and it is, and we are told that there are actions that we need to take to protect people's lives and livelihoods, then we will take those actions. And I think that people in Wales will appreciate that, despite the difficulties that I understand it creates for people and for businesses.
Thank you. And on the swift action that you've taken on the sporting sector, we know that being out in the open air is much safer than being indoors. But under the current regulations, as they will change on Boxing Day, you wouldn't be able to go to a rugby match or a football match, but you would be able to watch it in a pub, albeit with the restrictions in place in hospitality. Why not limit the number of people allowed into the stadiums, social distance as well? We've got big stadiums here in Wales, and that's a similar approach to what's happened in Scotland. And at least then it'll give the clubs in Wales a chance to make some revenue over the Christmas period.
Well, I don't think you're quite right, Dan, in suggesting that somehow in Scotland things are different. It is true that 500 people will be allowed to go and see a match in Scotland, but as you'll have seen, effectively, that means those matches will not go ahead with a crowd of people there. 500 people would go nowhere near to making those commercially sustainable for clubs. There are a number of points in your question. I think those clubs, rugby clubs and football clubs, have worked very hard to keep things safe during the Delta period. But we are concerned not about how people behave when they are at the ground, but all those additional pinch points, how people travel to them, how people come and go from them, how people act in hospitality around them. There are risks there that we do not need to run. And given that there will be thousands of cases of Omicron by the time we get after Christmas, those risks are absolutely real. Those risks are very different if you are in a venue with far, far fewer people and with all the additional protections that we have announced today. So, yes, you will be able to be in a pub with the new protections in place and watch a game on television, but you won't be there with 21,000 other people sharing the same space with you and trying to get in and out of the ground at the same time. So the circumstances are not comparable in that way, and that's why we have treated them differently in the regulations that I've been able to announce today. Dan, thank you very much. Over to Daniel Hewitt at ITV National.
Thank you. First Minister, you are moving to these much tighter restrictions at a time when the UK government says there simply isn't enough data to make such decisions. What do you know that they don't? Do you believe that Boris Johnson's delaying here is because of political reasons rather than health reasons?
I believe the UK government sees all the data that we see. I believe they get all the advice that we get about the need to act and to act urgently in the light of the Omicron wave that is coming our way and is already there in very, very significant numbers in London and in other parts of England. I think that the UK government is in a state of paralysis about all of this. We see the reports of infighting within the cabinet. There are, as I would see it, sensible voices urging the Prime Minister to act, to protect the NHS and to protect people's lives as he has in previous waves. And there are others who I simply think take a different view of the balance of risk here and are prepared to allow those risks to run. I don't believe it's because they don't see the data. They see the data, but they're not prepared to act on it.
And what is stopping a group of 30 people gathering in someone's home rather than going to the pub or a nightclub on New Year's Eve in Wales?
Well, the main thing that prevents it is people's own good sense and people's own understanding of the risks that they will be running. So if people are following the guidance that we have set out today, they would, of course, be avoiding the risk that they themselves will fall ill and could be so seriously ill that they could end up in hospital or may not survive the illness at all. So the main thing that prevents that from happening is people's experience of coronavirus and the harm that it does. We will have in regulations a maximum number of people who can gather inside a home, and that will be 30 people. So if the police do receive reports of house parties rather than family gatherings, the police will have a basis for intervening and checking that people are following the rules that would be expected of people at a time of a public health crisis. Then thank you very much indeed. Over to Will Hayward at Wales Online.
Thank you, First Minister. You must have looked at the implications today's announcement will have for jobs and livelihoods. Given that there's no furlough scheme, can you tell us what you think the costs will be in terms of job losses and business closures?
Well, we are hopeful that because shops will reopen, offices will reopen, hospitality will reopen, that the impact on jobs lost can be managed and that employers will have direct help from the Welsh Government to help them with some of that. We also hope that this will be a relatively short period. You know, if the modelling turns out to be reliable, a sharp rise followed by a sharper fall than we've seen previously, then we're not talking about this going on for months month after month. So our assessment is that the level of protections that we've announced today can be managed through the help that we will provide, the £120 million of new money that will be available for the month of January and into the start of February, in a way that allows businesses to stay alive and people to continue to be in work.
Okay, in terms of how long this will go on for, then Welsh Rugby will lose millions if crowd restrictions are still in place when the Six Nations starts in early February. Do you expect these restrictions to be lifted by then?
I really can't give you a prediction of what will happen in what would be 6 weeks from now. When I set out stuff in my original statement, I tried to demonstrate just how many things have changed in the last few days. So, you know, we have the best modelling that our colleagues in the universities can offer us, and it would suggest that January will see the peak of coronavirus, the new Omicron variant, and that things may reduce relatively rapidly once the peak has been passed. We will continue, of course, to work with the rugby union and other football and sporting bodies. We've announced £3 million already to help with the immediate loss of income that they will face in the post-Christmas period, and we'll go on in those conversations with them should the public health situation not allow games to resume in the way we would all like to see by that part of the new year. Well, thank you very much. Over to Ellis Roberts, newyddion.
Ia, diolch fawr iawn i chi, Prif Weinidog. Yn yr Alban, mae modd i hyd at 500 o bobl fynd i ddigwyddiadau chwaraeon. Yng Nghymru, hyd at hanner cant ydi o degfed rhan o'r Alban. Ydy hynny'n deg? O ystyried mae yna lawer iawn o glybiau llai, mae nhw angen y gefnogaeth.
Wel, yn yr Alban, mae ffigur o 500 o bobl, a mae'n glir, a dwi wedi darllen popeth mae'r sector wedi ddweud, mae hwnna'n mynd i cau a gemau fawr i lawr yn union fel ni'n neud e yng Nghymru. So, dydy y sefyllfa ddim a wahanol rhwngddo ni ac ar Alban. Ni wedi newid y gyfraith am gemau bach, ble bydd 50 o bobl yn gallu mynd i weld y gêm, ac mae'r nifer o bobl sydd ar y cae ddim yn cynnwys tu fewn i'r nifer o 50. A ni'n neud hynny achos ni wedi clywed beth mae clybiau bach yn ddweud. Mae nhw yn eisiau cael gynulleidfa fach, tu fas, ble mae hwnna ddim yn creu problemau i'r iechyd bobl. A dyna pam ni wedi newid beth oedd y gyfraith tro diwetha pan oedd rhaid i ni wneud pethau fel hyn. Ellis was just asking me whether it is fair that there are different numbers of people able to be at sporting events in Scotland compared to Wales. I was explaining that everything that I have seen and read from the Scottish Government and from the sector says that big matches will be played behind closed doors, that having 500 people at a large Scottish football match isn't going to make the difference between them being open as they are now and how they will be played in the future. And as far as smaller clubs are concerned, we are going to have a different regime this time to the regime we had previously. Previously, 50 people could take part, and that included players on the field. This time, the 50 people who can attend can all be spectators, and that the number of people who are playing will not be included within that 50. And that is because we've had representations from smaller clubs. That just allowing that number of people to be at a village game doesn't produce a adverse public health impact. And having considered what they've said and taken advice, we've decided that this time round, the 50 people who are watching won't include the people who are involved in the game itself.
Gai ofyn i chi hefyd, yn Lloegr yr wythnos nesaf, mae yna lawer iawn o ddigwyddiadau chwaraeon yn mynd i fod, ac mi fydd pobl o Gymru mynd i'r rheini siawns, yn mynd i Lerpwl, yn mynd i Millwall. Fyddech chi'n deud wrth y bobl hynny beidio mynd?
Wel, cawn ni weld beth sy'n yn mynd i digwydd yn Lloegr. Ni weld bob dydd nifer fawr o gemau'n cael ei ganslo, achos mae bobl sy'n chwarae yn cwmpo'n dos gyda'r Omicron. Y cyngor ni i bobl oedd yn meddwl am deithio yw byddwch yn ofalus. Meddwl yn fanwl am y risgs sydd ar gael. So, mynd trwy y restr o cwestiynau dwi wedi setio mas heddi. Yn diwedd y dydd, lawr i unigolion yw i wneud yr penderfyniadau na. Beth ni'n ofyn i bobl yw i wneud y penderfyniadau mewn ffordd sydd ymwybodol. Ble maen nhw wedi meddwl trwy'r pethau. Os mae y risg yn rhy is, yr ateb yw i peidio mynd. Ond wneud e mewn y ffordd ofalus ni wedi awgrymu. Ellis asking me about matches being played across the border in England. Should people go and watch them? Well, as I said, first of all, let's see how many games actually do get played, because matches are being cancelled, pretty regularly because of the number of people who are falling ill in teams that would otherwise be taking part. If people are thinking of doing it, it's not for the Welsh Government to make those decisions for people. What we ask people to do is to think carefully in making those decisions, to work your way through the sorts of questions that I've set out today, which would result in you making a decision that would keep yourself safe and other people. If you go through those questions and you come to the conclusion that the risks would be higher than the rewards, then of course you wouldn't go. But the key thing is to do these things in a conscious way, to have worked your way through the considerations that we have outlined and will be there in our guidance, and then to make the decision that keeps you and other people safe. Ellis, diolch yn fawr, ac yn ola heddi, draw I Thomas Evans, S4C.
Diolch yn fawr, Prif Weinidog. O ystyried bod nifer o'r achosion o Covid-19 yng Nghymru dal yn uchel iawn, chi wedi penderfynu aros tan wedi'r Nadolig, ond ydych chi wedi penderfynu newid eich trefniadau Nadolig eich chi am eleni, ac a fyddech chi'n annog pobl eraill I wneud yr un fath?
Wel, diolch Thomas. Wel, dwi'n trial I mynd ar ôl y cyngor dwi wedi setio mas heddi. So, ni yn wedi newid pethau. Dwi'n mynd I cwrdd gyda ffrindiau a teulu dros y Nadolig, ond dwi ddim yn mynd I weld nhw I gyd ar yr un diwrnod. So, mae teulu, mae fy mab a fy merch, mae nhw'n dod lawr dros y Nadolig, ond mae un yn dod ar un diwrnod, a'r y llall yn dod ar diwrnod arall. So, ni'n mynd I aros gytre, ni'n mynd I fwynhau y Nadolig, ond ni'n mynd I trial I wneud mewn ffordd sy'n ddiogel I ni ac I pob un eraill. Thomas asking me if we have changed our plans for Christmas in the light of the number of people who we see falling ill with coronavirus here in Wales. And I was explaining that we have adjusted our plans. We will be seeing family, we will be seeing friends over Christmas, but we have decided to space that out over the Christmas period. You know, my own daughter will be coming with her family to see us, and they'll come on one day, and my son and family will come, but they'll come on a different day. So instead of what we might usually have done, you know, everybody coming on Christmas Day, it'll be a spaced out Christmas on the basis that, as we said last week, a smaller Christmas is a safer Christmas, but you can have a good Christmas at the same time if you do things carefully.
Diolch I chi. A os gai edrych ymlaen at y flwyddyn newydd hefyd, pan mae clybiau nos a digwyddiadau chwaraeon yn gallu croesawu'r cyhoedd yn ôl unwaith eto, a fydd y passes Covid yn dychwelyd I chi'n meddwl gyda hynny, ac os felly ydych chi'n rhagweld y bydd yn rhaid I chi fod wedi cael y brechlyn atgyfnerthu, y trydydd dos o'r brechlyn, neu a fydd dau yn ddigon?
Wel, mae'n amhosibl I fi roi dyddiad ar y bwrdd ac yn ddweud, wel, bydd hwnna'n y dyddiad pan bydd pethau'n gallu ail agor, achos dyn ni ddim jyst yn gallu rhagweld beth sy'n dod ato ni fel na. Beth wedais I heddi yw ni'n dal bob wythnos I ail edrych ar y cyfyngiadau sydd da ni yma yng Nghymru, a ni'n mynd I wneud hynny yn y dyfodol. Hefyd, ni'n dal I defnyddio'r pas Covid mewn sefyllfa ni wedi wneud nhw o blaen, ac mae gwaith yn mynd ymlaen I roi y brechlyn argyfnerthu ar y pas. So bydd y passes yn defnyddiol I ni yn y dyfodol, ond ni'n mynd I wneud mewn ffordd gyda pethau eraill sy'n helpu I gadw ni gyd yn saff. Diolch yn fawr. Oh, Glenn, sorry, finally, Glenn Campbell from BBC Scotland is able to join us.
Hello from Holyrood. First Minister, you're tightening restrictions in Wales as Nicola Sturgeon is here, but why are you so convinced of the need to act when Boris Johnson tells us the science is inconclusive?
Well, we simply don't agree with that assessment. The science that we have seen, the clinical advice that we have seen, is very conclusive. Omicron is a far more transmissible form of the virus than Delta. Very large numbers of people will be affected by it. We need to act now in order to flatten the curve of infections that would be there if we didn't take action, in order to save lives, to protect the NHS and to keep businesses open. I think we've all broadly seen the same advice. The Northern Ireland Executive, the Scottish Government and the Welsh government have all come to the conclusions that action is needed and needed now. The UK government acting for England, it's not that they don't see the same data, it's just that they are paralysed by their internal divisions and unable to act on it.
First Minister, you decide on public health, the UK Treasury decides on finance. To what extent is your ability to deal with this new wave of coronavirus limited by that? And what response have you had to calls for the reintroduction of furlough?
Well, the measures that we have announced today are fundable by the Welsh Government using our own resources and having the safety net of the £270 million that the Chancellor announced at the weekend. Were the situation in Wales to get worse, and if we were to have to close businesses rather than allowing them to continue to operate with the protections we've announced today, then that would be beyond the capacity of any devolved government to finance ourselves. Only the Treasury has the firepower to be able to fund a furlough scheme and a self-employed scheme of the sort that they were prepared to operate earlier in the pandemic. So with the First Minister and the Deputy First Minister of Northern Ireland and with the First Minister of Scotland, we continue to urge the UK government to put those plans in place so that we are not artificially prevented from being able to take the decisions that keep people in Northern Ireland, Scotland or Wales safe from the Omicron variant in a way that would not apply in England. So that's what we're asking for, a level playing field, so we're all able to make the necessary public health decisions on the same basis. We're not there yet. The actions that the Chancellor has taken so far are welcome, but they are not sufficient. Diolch yn fawr. Thank you all very much indeed.